Hello everyone, welcome to Alacrity Explains Anatomy. Today we are going to be looking at the Circle of Willis. So by the end of this video, you should be able to define the Circle of Willis, state its anatomical location. You should know the major arteries that form the circle. You should be able to draw and label the circle, showing the connection between the internal carotid and the vertebro-basilar system. You should be able to describe the functional significance of this circle as an anastomotic pathway. You should be able to explain the clinical consequences of common anatomical variations and circle-related pathologies, that are aneurysms and stroke. So now, what is the Circle of Willis? The Circle of Willis is a hexagon-shaped or heptagonal arterial ring located at the base of the brain. It is the primary anastomotic network connecting two major arterial systems supplying the brain. These two systems are the internal carotid system and the vertebro-basilar system. The internal carotid system forms the anterior circulation, while the vertebro-basilar system forms the posterior circulation. So this is the basilar artery and this is the vertebral artery. So these together form the vertebro-basilar system, while these form the internal carotid artery system. So location, it lies in the interpeduncular system, a subarachnoid system at the base of the brain, surrounding the optic chiasm, infundibulum of the pituitary gland and the hypothalamus. Taking note of this location, it is located surrounds the optic chiasm, so there could be visual issues. It is a problem here. The infundibulum of the pituitary gland as well as the hypothalamus. What is the function of this circle? It says collateral circulation. If one of the main arteries is blocked, the Circle of Willis allows blood to be rerouted, protecting the brain from ischemia and stroke. Collateral circulation, whenever there's an obstruction of one of the vessels of the Circle of Willis, the other compartment or component of the circle can help to form an arterial supply to the affected part to prevent ischemia and stroke of the brain. Another function of this circle is equalization. Now it helps to equalize blood pressure between the right and the left hemispheres of the brain. So this is an image of the Circle of Willis. The component of this circle. The component of this circle, we have the anterior cerebral artery, we have the anterior communicating artery, have the middle cerebral artery, the posterior communicating artery, posterior cerebral artery, while the basilar artery and the vertebral artery are just arteries that their branches form this circle. This is the Circle of Willis. It has structures from the anterior part and you have from the posterior. Good. So the key mnemonic anterior to posterior. Actually, any pretty person can perceive beauty. Actually, any pretty person can perceive beauty. So we have the anterior communicating artery, anterior cerebral artery, anterior communicating artery, posterior communicating artery, posterior cerebral artery, and the basilar artery. So now, how is the flow? How does blood flow in the circle, in this circle, and what's the functional significance of this? Now the key concept here is that the circle is a safety mechanism. We already said earlier that it serves collateral circulation, so it's a safety mechanism giving collateral supply to different parts of the brain. Now the normal function is that under normal conditions, blood flows through the circle by mixing, but mixing is minimal. Yes, there's minimal mixing. It's not as if there's no mixing at all, but there's minimal mixing of blood as it flows in the circle. Now, the posterior communicating artery and the anterior communicating artery carry what? Little flow. The anterior and posterior communicating artery carry little flow. The collateral function, which we said is one of the functions of the circle, If a major feeding artery, let's take for example the internal carotid artery or the vertebral artery, becomes stenosed, maybe the right vertebral artery or the right internal carotid artery becomes stenosed or occluded. If it's stenosed or occluded, blood can reroute from the patent side, which is the functional side, to the deficient side. There is a stenosed or occluded artery, maybe right on the right side or on the left side, that's ipsilateral. Blood will be rerouted from the patent side, which is the normal side, to the deficient side through the circle. So for example, if there's the left internal carotid artery occlusion, look at this. You have this is your right and this is your left side, and you have there's an occlusion of the internal carotid artery of the right, let's say this one now, of the left. So what will happen is that blood is going to flow from the right internal carotid artery to the right anterior cerebral artery to the anterior communicating artery to the left anterior cerebral artery, then retrogradely into the left middle cerebral artery. You see, blood moved from the right to the left. There's an occlusion on the left side. On the left side, blood is moving from the right side to the left side. There's an occlusion on the right side, which is, let's say there's an occlusion here. In that example we give, there's occlusion on the left side, right? There's an occlusion on the left side, so blood is going to move now from this functional right side and from the right internal carotid artery to the right anterior cerebral artery, then the anterior communicating artery, then blood will now get to the left. So that is how it serves this collateral circulation. And the circle is not always complete. There are situations where you have an incomplete circle, and these incomplete circles fail to provide adequate collateral flow. It varies from person to person. Some people do not have a complete circle. Now, what are common anatomical variations? A classic complete circle of the Circle of Willis is only found in 20 to 50% of individuals. There's always variations, so we'll look at the variation, the frequency, and the clinical implication of these variations. The first one here, we have the hypoplastic or small anterior communicating artery. You can have a hypoplastic or a small anterior communicating artery, which is common in 30% of individuals and results in limited cross flow between the anterior cerebral arteries. That means the right and left anterior cerebral arteries. We have hypoplastic posterior communicating artery, which is common in 20 to 25% of individuals. In this situation, there is a poor communication between the internal carotid and the posterior cerebral artery. Please make sure you draw this circle. Make sure you learn how to draw this circle. That's the best way to understand this circle. It exposes posterior circulation to ischemia. We have fetal posterior cerebral artery. It's about 15 to 20% of cases have this. The posterior cerebral artery arises directly from the internal carotid artery instead of the basilar. Normally the posterior cerebral artery, look at this image, let's use this one. The posterior cerebral artery, which is this one, arises from the basilar artery, but in this situation it will now arise from the internal carotid artery directly. So we call that a fetal posterior cerebral artery, arising from the internal carotid artery instead of the basilar artery. So this posterior communicating artery is large. In this situation, it is large, making the basilar artery what? Small. It increases risk of posterior cerebral artery stroke with internal carotid artery occlusion. There could be cases of an absent anterior communicating artery, whereby the right and left anterior cerebral arteries have no communication. So there is no anterior collateral pathway on the right and left side. In this situation, it is rare and in about less than 5% of individuals. Now, what are clinical correlates about the Circle of Willis? We have the cerebral artery aneurysm. Cerebral artery aneurysms, we have the circular berry aneurysm, which occurs at a branch point, or bifurcation point due to medial wall defect. There's a defect in the medial wall of the blood vessel. There could be a circular or a berry aneurysm. This is what we refer to as an aneurysm. There is dilatation of an artery. The berry aneurysm burial aneurysm is on the anterior communicating artery of the brain. This is the most common site. So the most common site of burial aneurysm is the Circle of Willis aneurysm triad. There are 3 parts or 3 sites which are the most common site for burial aneurysm, and we're going to mention them in the order of most common. We have the anterior communicating artery, which is the most common, and about 30 to 35%. This aneurysm may rupture, causes visual defects. Remember, we said that the circle is around surrounding the optic chiasma, so this could result in visual defect or memory loss. Now, the second most common site is the posterior communicating artery. The posterior communicating artery is the second most common site, and rupture often results in compression of oculomotor nerve, cause a down and out eye movement plus ptosis. Then the third most common site is the bifurcation of the middle cerebral artery of the internal carotid artery. Is not strictly part of the circle. Remember, the middle cerebral artery is not strictly part of the circle, but is adjacent to it, and is the third most common site for cerebral aneurysms. And we have the subarachnoid hemorrhage, which is rupture of the blood vessels in this circle, resulting in hemorrhage, bleeding of blood into the subarachnoid space. This causes what patients refer to as the thunderclap. Physicians refer to as the thunderclap headache in ruptured circle aneurysm. They feel like the patient will be describing the headache as if there is thunder. So this is an aneurysm. So we have ischemic stroke and collateral failure. Ischemic stroke and collateral failure. The proximal internal carotid artery occlusion. In case of a proximal internal carotid artery occlusion, if the anterior communicating artery is patent, remember we said earlier that we can have a variation whereby there is an absent anterior communicating artery. So the right and left anterior cerebral arteries are not connected to each other. So there is no anterior collateral pathway connecting this system. So in this situation, if the anterior communicating artery is patent, it's going to be collateral anterior cerebral artery fills. The anterior cerebral artery on the other side get filled with blood, so there's minimal deficit. But if the anterior communicating artery is hypoplastic, where it is reduced in size, the major anterior cerebral artery and the middle cerebral artery stroke on the occluded side now get affected, because the anterior communicating artery that is supposed to communicate the right and left anterior cerebral artery is hypoplastic. So whenever there's an occlusion on one side, collateral circulation becomes a problem. So we have vertebral occlusion with fetal posterior cerebral artery. In this situation, there's no flow to the occipital lobe. This is the occipital lobe of the brain. There's no flow to the occipital lobe of the brain through the circle, resulting in cortical blindness, because this is the visual area of the brain is located in the cortical, in the occipital lobe. So take an assessment. This is what I'll ask you to do. Draw the Circle of Willis and label all the 5 components of the circle. And your second assessment is a patient present with a sudden severe headache and an ipsilateral dilated pupil with a down and out eye. Which artery is most likely the site of aneurysm? Which artery is most likely the site of aneurysm? Third question, explain why a person with hypoplastic posterior communicating artery might suffer an occipital lobe stroke after the occlusion of a vertebral artery. That will be all for this video. Thank you for watching. Don't forget to like, share, and subscribe to Alacrity Explains Anatomy for more videos. Thank you.